but I have yet. Thank you for that recording. We're presenting the Federation for Children with Special Needs healthcare information. I'm Melanie McLaughlin, Project Director for Mass Family Voices, and I was just introducing myself to folks and the Federation. And so the Federation for Children with Special Needs, their mission is to empower families, essentially, and we do that through a number of ways: projects and education and information and galas and conferences and what have you. And what I loved about the Federation when I really became a member was that it expanded our community, tenfold, and people of all types of disabilities and backgrounds. So I was super grateful for that. Here's some of the services we offer. Again, just giving folks a little background on the Federation. You can learn more at fcsn.org. And so the presentation that we're going to do tonight is called Connecting Families, which Leslie mentioned. We have a monthly presentation where we bring all types of topics to the community. So share it with friends, let them know, sign up yourselves and let others know that we do this on a monthly basis, and you can see what we're presenting on our calendar on our website. So tonight we're going to have a casual conversation, which is a little bit of a hodgepodge of healthcare stuff. We're not going specifically into one area. We're going to do sort of 3 areas that I thought might be useful for you guys in a 1-hour session where we can have time for question and answer. So this is some of the things that you're going to learn in this presentation. We're going to talk a little bit about vaccination and vaccination info. And we're going to talk about mass health redetermination and what that is. And then we're also going to talk about a healthcare notebook and how you keep all this information organized. The slides will have links to resources for you. You will get a copy of the slides after the presentation, emailed to you, and you'll be able to access the links. So we hope you're going to use them. So for vaccines, essentially a fact about vaccines are that they're an effective method of preventing life-threatening diseases and illnesses for all individuals, and especially for our more vulnerable individuals, people with disabilities, children and youth with disabilities. And they do that by boosting the body's natural immune response to the particular, disease or infection that we need to fight. So I just gathered together a couple of myths, and I'm not going to read all of this to you. Like I said, you guys can read it, and we can talk more about myths versus facts after if you want. But here's some of them. Like you might have heard this in the community or social media or any of those other places, but things like vaccines contain harmful ingredients. There's a lot more information on the website listed on the bottom of the slide, but essentially they do have some ingredients that can be harmful in large doses. But as even is mentioned in the myth versus fact number 1, water can be lethal in large doses. So it's the doses of the items that are in the vaccine are small enough that they do not adversely affect individuals or, are harmful. The myth 2 that vaccines cause autism or SIDS, you can read all of the different things that they talk about here in terms of the response to that. But I'll tell you, the bottom line is there's no scientific evidence that vaccines cause autism or SIDS. Part of the reason that people think that there can be a correlation is because those diagnoses in the vaccine usually occur around the same age frame. So, they happen to be concurrent. So people think that there's a relationship, but as far as, they've been able to tell to this point, there's no scientific evidence that that is fact-based. And so myth 3, vaccine preventable diseases are just part of childhood, and, they should get the disease, and, they'll, their regular childhood response will help them, ward off the disease. And, the reality is that, 20,000 children die every year in the United States because of flu complications of flu. And I didn't dig into that quantitative details for children, but I can tell you, I'm sure that a disproportionate number of them are children with disabilities or children who have compromised and serious compromised immune systems and serious healthcare needs. So, 20,000 might sound like a statistic to people, but when it's one child too many. And if it's your child, it's more than one child too many. So I think it's important to remember those things. And then myth 4, I don't need to vaccinate my child because everybody around them is vaccinated. So essentially that's what you might have heard called herd immunity. People talk about, if enough people get the vaccination, then you don't need to, because there creates a herd immunity essentially and weeds out the vaccine. But the reality of that too is that if everybody thought that way, then there would be no herd immunity. So it's not really a helpful thing to sort of really say, because it can cause damage in the long run, because we wouldn't have the herd immunity. And again, you can read more of the slides there when we're able to share them. So some specific COVID myths. So we were talking a little bit, I'll talk a little bit about just COVID vaccine and the flu vaccine, mostly because I don't have time to get into all the other vaccines, and certainly because I'm giving you some resources where you can look at other vaccines that you might be wanting to know more about. But again, here are some myths. Some of them are repeated. You may have heard things like it changes your DNA. They get more into the science of that on different websites, but it does not change one's DNA. That there are other severe side effects, or that it can make you infertile, or that it wasn't safe, or that, that's a chip that tracks you. All sorts of myths out there. And unfortunately, with social media, those myths just get promoted and promoted and promoted. And sometimes if people say things often enough, they think that they're fact. But for me and for my children in particular, I really want to go with science-based evidence to know more about vaccines. And particularly my child I have 3 children, 2 young adults in college, and a teenager. And my teenager has complex healthcare needs. And we do everything we can, as I'm sure you all do, to keep our children safe. Here's some information about the flu vaccine. Something that I thought was interesting in this, I could have just done a whole presentation, like I said, and for more than 1 hour for, days really on vaccines. But one of the things I tried to pull out information from places that I thought were, interesting, or things I hadn't necessarily heard before. These studies I think are interesting to find out more information, but, when should you get a flu vaccine? And I didn't realize that sometimes children need 2 doses of a flu vaccine. And how do you space them apart? So you want to make sure that when you're getting the flu vaccine, you get it early enough so that you have 4 weeks before flu season really starts. Or like they said, you can do July and August to start early before the flu season really starts. And here I thought was a few really cool social stories. So about how to talk about vaccines, about how to share information with your child and family about vaccines. And, I just grabbed a still so you guys could see it, but I do want to click and show you guys this one. I thought it was kind of neat. You can explore these independently, but I liked this one. Hopefully it won't be too much of a problem going back. Yeah, so this is COVID-19 materials that were developed for people with intellectual and developmental disabilities and care providers. And I believe they were developed in addition to by people with intellectual and developmental disabilities and caregivers. So there's different social stories, interactive stories, videos, things about masking. But I like the fact that they really included self-advocates in those presentations. And there was another one I really liked that I wanted to show you guys. Let me just see. Yeah, the self-advocacy org one as well. Oh, that's odd. It worked earlier today. So excuse me, that is not linking tonight. I don't know why, but let me know if you're not able to access it and I'll suss that out with the organization. Um, but you can look at all sorts of social stories if you want to decide what's best for your child. Where is this resource? Hold on. We were looking at these and they're not coming up now. So I'm not going to worry too much about it right now, guys. I will look at them again and see why it's coming up to a different page, but I checked all of them earlier. So maybe it's just driving to somewhere else where we have to do a second click. But in any case, there's lots of social stories out there for vaccine information. And if you need help in finding any, I'm happy to help you find them. And they're all age and ability levels to be able to share important information with your children and family. And then where can you get an updated vaccine? This is, COVID specific, but also you can go to vaccines.gov to find out about other vaccines that we didn't get a chance to talk about today. But, there's lots of places you can get updated information for your vaccine. So your pharmacy, doctor's office, health centers, lots of locations. So the vaccines.gov has a great, and this started during COVID, where you can text your zip code and call numbers and find out where not to just get, not where just to get the COVID-19 vaccine, but other vaccines as well. And also to ask specific information, like if I've had 2, do I get the 3rd? When do I get the 3rd? Does my child under 12? I mean, there's so many individual questions that you can ask that I won't know all the answers to here tonight. But like I said, if I don't know the answer, I'll find it for you, or you can text information or go online to vaccines.gov. So that's pretty much our discussion about vaccines. We just really want to make sure that people are informed, have up-to-date information, understand vaccines, understand the science behind vaccines, and let us know if they have any additional questions, because we want to make sure that our children are protected. And this is great too. This is the dial, the disability information and access line. I didn't know about this, but again, it was launched in 2021, specific to helping people with disabilities get COVID vaccines, but they also provide other essential services like transportation, support, disability rights information, what have you. But it sounds like it's a really cool organization to be able to get access to vaccines. And I'm assuming they help with, transportation to get vaccines, what have you. So looks like a great organization, and I want to find out more about them. So I will be. So now we're going to switch over a little bit to Mass Health. So some of you might have come on explicitly for this information. And I'm sure if you have Mass Health, or if your child has Mass Health, there's lots of, paperwork you've had over the past, and lots of information, and lots of, time on hold potentially on your phone, and all sorts of things. So what's going on right now with Mass Health that you really need to know, and what we want to make sure we're getting information out to you. We did have a connected families earlier on Mass Health with representatives from Mass Health, and we now, as the Federation, are working with Mass Health specifically on their eligibility redetermination outreach campaign. So we wanted to make sure that we were getting information out to families like yours, children and youth with special healthcare needs, and communities and organizations, professional partnerships like yours that are working with children with complex healthcare needs and their families, because we want to make sure folks don't lose access to their insurance. So Mass Health, typically annually reviews eligibility status. In the past, it's usually been around November, December. That did not happen for the 2 years of the public health, 2+ years of the, public health emergency, because, it was an emergency. They didn't want to burden people, obviously, for so many reasons. They wanted to make sure people had insurance, and that they weren't worrying about paperwork. So Mass Health did not do any redetermination. During the pandemic, they did enroll 2.4 million more people in Massachusetts during the pandemic. And now, since the public health emergency has been lifted as of April 1 from the federal government, they now need to do redetermination eligibility. So they are going to be going through, the massive amounts of clients that have Mass Health and looking at whether they're eligible to continue to have Mass Health. So the most important things, this is the basics, like a very basic communication around Mass Health eligibility. The most important thing is that you need to make sure that Mass Health has the most up-to-date personal information for you. That means an accurate phone number, a email, an appropriate address, all of those things. You need to make sure that that's all up to date. If you receive mail from Mass Health, which it'll start coming again, and for folks who've received it before the pandemic, they know it can be a lot. But you got to open them, you got to look at them, you got to read them. If you have difficulty reading them, difficulty understanding them, there are organizations like ours, like the Federation, like me, who can help you. So reach out to us. If I can't help you for some reason, I will find, someone that can, and we will help you get through whatever it is Mass Health is asking for. And respond. You have to respond to Mass Health if they're asking for information from you, because if you don't, they have timelines where people are dropped from the roster. So if you don't respond, you're at risk of being dropped. One really important thing to remember, and Mass Health is trying to make sure people understand this, is that not everybody will be, need to be redetermined. People might already have information in there. That's okay. So, if you don't hear from Mass Health and, you don't get information and your address and email and all that stuff, phone number is up to date, then you probably don't need to, give them new information. It doesn't hurt to check anyway. There's ways that you can do that online. I, gave you the Mass Health Renew link there that you can find out how to do that. You can set up an account online. You can go to your Mass Health Enrollment Center. You can find out where those are on that website. You can email me and I can tell you where they are, any of those things. But if you receive this blue envelope, that Mass Health is really, trying to flag for people to make it recognizable, for people to understand it and see it. I understand they just sent a sample of it out to people saying, look out for this, but it's a response required. And so they, you have to know that if you get that, that means they're letting you know you have missing information and you need to make sure that you respond to that. So I also, I wanted to see this YouTube. I wanted to actually put this in the YouTube. I'm going to wait to see how many questions we have, but this is just a little YouTube that's on this page for Mass Health Renew. And it explains to you essentially what I just said. If you want to see it again in a video, an animated video, it's there. And also you should know that this information is available in multiple languages. What's really great is they also have a toolkit. So if there are organizations that are on this call today, or organizations that need to get this information out to constituents in their community, to people that need the information, there's a toolkit that provides, links to social media posts with pictures and posters and all sorts of things. Also, because the Federation is is a partner with the Mass Health and Healthcare for All to share the information and outreach on redetermination. We have brochures, posters, rally signs, bigger posters, all sorts of things that we can share with you. We can mail them to you if you want them for your organization. You can pick them up. We will be tabling at events for Mass Health. If you know an event that's coming up and you think this would be really good information to get out to people, please let us know. We want to make sure essentially that we're getting the information out to as many people as we can. So this is actually vaccine. I'm sorry, this slide was one before, but this is actually from Family Voices, which is the national parent organization for Massachusetts Family Voices. And they are looking for parents to respond to information about vaccination. So they want to understand what you want to know and how to better serve you. So excuse me for backtracking on vaccination for just a minute. So you can go to that SurveyMonkey link, or you can use the QR code to access that survey, but we're really asking folks to fill out that survey if they will. And particularly they're asking for folks, with diverse experience and diverse backgrounds. I think the primary respondents to the survey have been a Caucasian population, and they really want to understand where folks are coming from in other communities to make sure that they understand what it is folks need or want to know about vaccination. So I'm going to go back for a second. So, okay, here's the basics on Mass Health. And again, continuing Mass Health. So this is an example of one of the brochures that we have for Mass Health in our office that you can share. It's a trifold brochure. One side is in English, the other side is in Spanish. And again, we have many in other languages: Haitian Creole, Portuguese, Vietnamese, Chinese, and I'm forgetting some of the languages now, but you can see on the Mass Health Renew the languages there, and also reach out to me and you can ask. So it really gives you the information we just talked about, right? Update your personal information, check your mail, make sure you respond. That's the 3 things they really want you to know. And then there's more information on the right about ways that you can do that through customer service, online, this barcode. In person, you can go to your healthcare enrollment centers. And we ask that if you're taking the time to be on the call tonight, thank you so much. And we also ask, please share this information with other families that you know. So I think we all know, as families with lived experience, oftentimes we get the most comprehensive and best information from other families with lived experience. So please let other folks know that they need to know this information. So this is a lot, right? It's like, oh, this is a lot of information. I need to know about vaccines, and I need to know about Mass Health redetermination. And, I'm already scheduling all kinds of appointments for my kid, and, all sorts of things going on. What do I do? How do I manage all of this and all of this information? And so I think, a healthcare notebook has been something that's been really handy. And this is something that shortly after I started with the Federation, I saw my first example of. I hadn't seen them before. And I was like, oh, this is great. It's so important. And as families, we are, typically the experts on our children and youth, but we get tired. We might not have the information with us. A lot of us do. A lot of us already have this. I'm sure it was parents that initially created this. And there's lots of ways that you can, put your information together. There's some links on the bottom to specific pages you can download, to samples of healthcare notebooks that you can create yourself, to, different checklists and information to have that there. Because, the other piece is, like, one person in your family might know this information, but maybe others don't. And so if that one person is the holder of all that information, it's not going to be shared or related with other family members who might need to know it at a certain point. So it's good to have this material together. And one of these days, I think maybe we'll do an in-person, build our healthcare notebooks together, and have an event where we can sort of chat and get to know each other, and maybe create healthcare notebooks together. So that might be something a little farther down the line to look forward to doing in person together. And so, how do you, this is when you see this massive information on the right, I'm sure folks can relate to that. This is actually a colleague created this. Her name is Kristen Lind, Lind. And she was in a fellowship, in the LEND Fellowship. If you don't know about the LEND Fellowship, I'm happy to tell you more about that. If you're interested in a year-long fellowship learning about neurodevelopmental disability and leadership. I was a Crocker Fellow, which is a faction of the LEND Fellowship. Kristen and I were in our fellowships together, and Kristen created this care map as she was thinking about all of the things that she needed to coordinate for her son, who is G, in this in this care map. And I think it's completely relatable, right? If you start to look on all the different things. And when you put it out there like that, it's like, that is really a lot to manage. And I think it went viral. And it makes sense that it did. Doctors and others use this in their presentation often to help folks understand just how complicated negotiating healthcare and healthcare systems and other systems are for families of children and youth with special healthcare needs. So, where do you start, right? So here's a thing of, a list, and, decide how you want to organize and some other things. But also here's some apps that I thought were kind of cool. So, there's a care map. So if you do a lot of your stuff at Boston Children's Hospital, there's an app where you can sort of put all that information in. I was actually just at a session with pediatric residents recently, and they were like, I wish there was a way that we could get all this information from parents. I'm like, you have this My Children's portal, for example, but they don't have, like, in the My Children's portal, there's not an opportunity for families to really upload video of their kids to show the doctor, like, or doctors, what their child's personality is like, or what their symptoms may be, or any sort of narrative information, or any way to sort of really paint a picture of who the child is as a whole. Some of you might have, like, or youth, some of you might have, like, the one page about you, that a lot of folks have, but they don't necessarily have that as specialists. And so, and they might not be getting a whole picture of the child. And so thinking about how you can provide that to your, essentially, community, to your child's universe, to all of that is helpful. And so these are some apps that I thought were interesting to help track things. For me, we do, tracking certainly of, like, different, cycles for my daughter, for example. We track that so we can really, pay attention to mood and pain and, other needs, because she might not tell me if she's really experiencing pain. And, I have, my own lived experience, but also another young adult daughter who sometimes is really incapacitated by pain in that experience, and, is able to go ahead and get herself some pain medicine. And so really teaching those advocacy skills, but also tracking them is important in case she's not really sharing. I can sort of look and know, and teaching her to do that more importantly, actually. So we're at about, like I said, I knew it was going to be a brief presentation because I wanted to leave time for conversation, and because it's a lot to try to put in a couple of different things in a cohesive way to talk about 3 different topics in connecting families. But I wanted to do that because I wanted to make sure that you guys were getting the most up-to-date information, both about vaccines and the mass health campaign, and then knowing how to organize that. So we do ask if you would please, take the time to fill out this survey about the presentation. We're going to get to the Q&A in a minute. During the Q&A, we'll stop the recording. So families, and others can have some privacy. We do ask that folks, keep things here that we say here, so people can feel a little bit more willing if they want to talk. And if they don't feel comfortable, you can always, like I said, reach out to me via email or voicemail. So there's a link. It's also in the chat. If you could just please fill out the survey so we are able to use that feedback to know how to improve our presentations for you, and also to be able to report to our grant providers so that they know that we're getting this information out to you and that we're doing some outreach. And I want to know if you folks have questions, so I can stop sharing my screen now. I just want to show you just sort of information to contact us. There's an intake form online if you don't want to call. There's also a language line that you can call and leave a message. When you hear the prompt for your language, that message will be picked up, and we will either have a person who can reach out to you using the language line, or a person who speaks your language in our outreach team. And then, yeah, there's our link to our website. So any questions?